We're fortunate at Children's. We have one of the few pediatric neurocritical care programs in the country. It was launched just a few years ago, and we're also privileged to have one of the leading pediatric specialists operating our clinic. And we invited Dr. Jose Pineda, the director of our Neurocritical Care Program, here today to make a few remarks about, from a physician's view, what these brain injuries mean and how important it is that we begin to address these in a more proactive way. Jose?
Thank you, Lee. I want to take a couple of minutes to cover 2 points. One, to share with you a few things that you may not know about concussions and how serious they are. And second, as a clinician and as a father of 2 daughters, to tell you why this is so important. First, things that you may not know about concussion: girls have higher concussion rates than boys when doing similar sports, such as soccer or basketball. Concussions can cause very serious symptoms that will interfere with the school performance, social life, and family life. A concussion can make a whole family fall apart. It's a very, very serious issue. And we also need to be in constant alert to catch that one child that is going to have the mild concussion, so to speak, that evolves to a fatal injury. That was mentioned just a few minutes ago. So this is also an important unknown sometimes of concussion. The symptoms can appear hours after the accident. So everybody has to be really educated about what they need to be looking for. And importantly, we have a plan. We know that cognitive and physical resting will help a concussion heal better. And that leads me to emphasize why the effort by Representative Gatchenberger and everybody else on this bill is so important. Turns out that we already have the tools, we already have educational plans, we have an action plan to treat concussions and detect them, but the plan will not be implemented universally if it wasn't for efforts such as this. One of my colleagues, Mark Halstead, who is an expert in concussion, is not here today. He's in Chicago, actually working with the American Academy of Pediatrics on further treatments for concussion. And they came up with a paper last year that gives every pediatrician and every healthcare provider a very well described plan on how to deal with concussions. Now, what is going to help us make that plan a reality is going to be House Bill 300. So we're really excited about your effort and very thankful. Now I'd like to introduce Tom Martin. Tom Martin is neuropsychology at the University of Missouri in Columbia, and he's immediate past president of the Brain Injury Association of Missouri.